Good afternoon, everyone. I'm going to present a case on Usher syndrome. A 23-year-old female came with a complaint of diminution of vision for 2 years, which was insidious in onset and gradually progressive and painless in nature, and which was more during the night. She had a past history of difficulty in hearing since childhood. There is no significant family history, personal history, and no significant ocular history. General examination and systemic examination were normal. On ocular examination, she had a normal head posture and no facial asymmetry, and her best corrected visual acuity of right eye was 612 and left eye was 6.9. On anterior segment examination was normal, with IOP is normal, and on right eye fundus examination, media was clear. Optic disc pale disc is seen with CDR of 0.5, and arterial attenuation with AV ratio of 1:3, and sclerosed vessel is seen in inferotemporal quadrant. Pigmentary changes are seen on macula, and bony spicules are seen in periphery in all quadrants. On left eye fundus examination, media was clear and pale disc was seen with 0.5 CDR. NRR healthy, and arterial attenuation was seen, and pigmentary changes were seen on the macula, and bony spicules seen in periphery in all quadrants. A provisional diagnosis was made as retinitis pigmentosa, both eyes retinitis pigmentosa, and visual field examination was done by confrontation test. Both eyes visual field restriction was seen in all quadrants, which was confirmed by HFA. The ring scotoma is seen, and tunnel vision is seen in the 10-2, and audiometry was done, and moderate to severe sensorineural hearing loss was seen in both the ears, and both eyes. Usher syndrome type 2 was a final diagnosis, and pedigree chart was drawn in which all the other family members do not have any disease. So and we explained the nature and progression of the disease to the patient, and prescribed glasses and hearing aids to the patient, and genetic testing was advised, and counseling was given to the patient. In blood relatives and kids were advised for the eye examination to find out whether disease is present or not, or retinitis pigmentosa. And vitamin A was given, and she was advised to have a diet with lutein and zeaxanthin. Discussion. Usher syndrome is a rare autosomal recessive genetic condition that is characterized by progressive vision and hearing loss. 13 genes and 16 loci have been found to contribute to Usher syndrome. It has been classified into 3 major types based on the genes responsible and onset and severity of signs and symptoms. Type 2 is the most common, with moderate to severe hearing loss, with RP onset in second decade and normal vestibular function. In type 1 is most severe and with absent vestibular function, and type 3 is the rarest with progressive hearing loss and variable vestibular dysfunction. Conclusion: Usher syndrome is a rare disorder with vast clinical and genetic heterogeneity, typically resulting in significant dual sensory loss, causing great impact on patients' quality of life. It is currently incurable. However, gene therapy is one of the potential treatment modalities that are being researched and developed for potential future cures. Take home message: any patient with retinal degeneration suspected of even slight hearing loss must receive audiological evaluation and treatment to minimize the effect of major sensory problems that arise from combined hearing and vision deficits. Thank you.
Yeah, doctor, a quick question. As shown, other relatives in the family did not have any syndrome of RP or Usher. So why is that so?
They might be carriers.
Right.
They might be carriers.
Yeah, so inheritance of RP is actually interesting. It may be AD, AR, or X-linked. And Usher is, what I remember is that
autosomal recessive.
Autosomal recessive. Yes. So that's why. Okay.
Do you know of another syndrome with hearing defect as a component, along with ataxia?
Ataxia, ma'am.
That's how you distinguish it from ushers, actually.
Yes, ma'am.
Okay, you can go and read that up. Okay, let's.